Hi students, today we are going to discuss about the biotransformation or metabolism of drugs. This process is also known as detoxification. Definition of biotransformation is the chemical alteration of the drug in our body. As a result of this, there is conversion of drugs into a water-soluble or polar compounds. So the drug can be easily excreted through renal system. The major site of drug metabolism is liver. Other sites include our lungs, plasma, kidney, etc. Consequences of metabolism. The result of detoxification can convert an active drug into an inactive form. Example is phenobarbital is converted to hydroxyphenobarbital, which is an inactive form. Sometimes, as a result of biotransformation, there is a conversion of active drug into an active metabolite. Example is codeine is converted to morphine. Sometimes there is conversion of an inactive form of drug into an active form. These type of drugs are known as prodrugs. Example, levodopa is converted to dopamine. Levodopa is used for the management of Parkinsonism. Pathways of drug metabolism or reactions. There can be phase 1 reactions and phase 2 reactions. Phase 2 reactions are also known as conjugation reactions. Phase 1 reactions are carried out by microsomal enzymes. Types of phase 1 reactions are oxidation, reduction, and hydrolysis. In oxidation, there is addition of oxygen or removal of hydrogen ions occurs. Example is phenobarbital. The subtypes of oxidation reactions are oxygenation and oxidative deamination reactions. Reduction reactions. There is removal of oxygen or addition of hydrogen occurs. Example is warfarin. Subtypes of reductions are nitro reduction or keto reduction. Hydrolysis reactions. There is metabolism of drug by addition of water. Examples are esters and lignocaine. This is done by non-microsomal enzymes like esterases and peptidases. Phase 2 reactions or conjugation reactions. It involves conjugation of drug with an endogenous substrate to form a water-soluble compound which is easily excreted in urine or bile. Most of the reactions are carried out by non-microsomal enzymes. Types are glucuronide conjugation, acetylation, methylation, and glutathione conjugation. In case of glucuronide conjugations, the drugs are conjugated with glucuronic acids. Example is bilirubin and aspirin. The enzymes involved in this type of reactions are glucuronide transferases. Then the second one is acetylation reactions. The drugs are conjugated with acetyl coenzyme A. Example is isoniazid. The enzymes involved in this type of reactions are N-acetyl transferases. The third reaction is methylation. The drugs are methylated using methionine as methyl donors. Examples include adrenaline and histamine. The enzymes involved in this type of reactions are methyl transferases. About glutathione conjugations, the drugs are conjugated with glutathione. Example is paracetamol. The enzymes involved in glutathione conjugation reactions are glutathione S transferases. Drug can undergo either phase 1 reactions followed by phase 2 reactions and converted into an inactive form or a water-soluble compound, and can be easily excreted through urine. Some drugs undergo phase 1 reactions only and they converted to an inactive and water-soluble form, and these are easily excreted. Some drugs only undergoing for phase 2 reactions and they converted into an inactive form, and it is eliminated from our body. Some drugs are eliminated as such. They undergo some molecular rearrangement. The enzymes involved in biotransformation, there are two groups, microsomal enzymes and non-microsomal enzymes. The microsomal enzymes are present on the endoplasmic reticulum of mainly liver. Types of microsomal enzymes are cytochrome P450 and glucuronide transferase enzymes. They catalyze phase 1 reactions and phase 2 glucuronide conjugation reactions. The non-microsomal enzymes are present in cytoplasm of liver, plasma, etc. The types of enzymes are esterases and amidases. They catalyze the phase 2 reactions except glucuronide conjugation. Glucuronide conjugations are catalyzed by the microsomal enzymes. Then enzyme induction and enzyme inhibition. Enzyme induction means administration of certain drugs will increases the synthesis of microsomal enzymes. Such drugs are known as enzyme inducers. Examples are phenytoin, phenobarbital, and rifampicin. Hence, the rate of metabolism of the drugs may be increased. Clinical relevance of enzyme induction. As a result of enzyme induction, sometimes there are adverse consequences occur, such as therapeutic failure. We use an enzyme inducers like rifampicin. They accelerate the metabolism of co-administered drug. This will lead to therapeutic failure of co-administered drug. Examples are oral contraceptive pills and rifampicin. Rifampicin is an enzyme inducer, hence it causes rapid metabolism of oral contraceptive pills and causes therapeutic failure. Sometimes the enzyme induction causes toxicity of drug because an enzyme inducer can accelerate the metabolism of paracetamol, leading to the production of toxic metabolites and causes hepatotoxicity. Prolonged usage of phenytoin therapy may cause osteomalacia due to enhanced metabolism of vitamin D3. It is necessary for the health of bone. Autoinduction means some drug induces its own metabolism and leads to development of tolerance. Example is carbamazepine. In some cases, enzyme induction can be beneficial also. Example, giving phenobarbital in neonatal jaundice. In neonatal jaundice, bilirubin cannot be conjugated and hence bilirubin will not be excreted. When phenobarbital is given, it will induce the enzyme glucuronide transferases and glucuronide transferase will conjugate bilirubin and enhances its secretion. Enzyme inhibition. Administration of certain drugs will inhibit the activity of metabolizing enzymes. Such drugs are known as enzyme inhibitors. Examples are erythromycin, ketoconazole, and cimetidine. Clinical relevance of enzyme inhibition can cause toxicity of the co-administered drug. Example, when erythromycin is given along with warfarin, warfarin metabolism is reduced in presence of erythromycin. This will lead to increased plasma concentration of warfarin and leading to toxic manifestations such as bleeding. Then about the first pass metabolism. Is the metabolism of a drug occurs before they reach in the systemic circulation. Major sites of first pass metabolism are gut wall and liver. Pre-systemic elimination or first pass metabolism. Here, the metabolism of the drug occurs during its passage from the site of administration in the systemic circulation. The major sites involved are gut wall and liver. Consequences of pre-systemic elimination or first pass metabolism. There is reduced bioavailability and reduced therapeutic response. Examples including lidocaine, which is a local anesthetic having high first pass metabolism. What are the methods to overcome first pass metabolism? By administering the drug via parenteral route, such as the drug compared to oral route, there is maximum bioavailability of parenteral route because there is minimal first pass metabolism. Or in some cases, we have to increase the oral dosage for some drugs such as propranolol. Then about Hoffman elimination. There is inactivation of the drug by spontaneous molecular rearrangement. Example is atracurate. What are the factors influencing metabolism? Age of the patient. As age advances, rate of metabolism will decrease. In liver disease, presence of liver disease reduces the metabolism of drug. Presence of some coadjuvants such as smoking and cause enzyme induction. Some genetic variation affects the drug metabolism. Succinylcholine metabolites slowly in patients having defective pseudocholine esterases. The important questions from these topics are biotransformation, definition, phase 1 and phase 2 reactions, then about enzyme induction and inhibition, clinical significance of enzyme induction. As a result of enzyme induction, there is therapeutic failure, and enzyme inhibition causes toxicity of co-administered drug. Then about the first pass metabolism. First pass metabolism is metabolism of a drug occurs before reaching the systemic circulation. As a result of high first pass metabolism, there is reduction in bioavailability.